Hi Mrs. B, thank you for coming in today. I would like to discuss your new lifestyle as a person living with type 2 diabetes. Thank you for writing down all your questions. We will discuss them one by one. Let's look at what diabetes mellitus is. It is a chronic, lifelong condition where blood sugar levels rise due to your body's decreased sensitivity to insulin, as well as your pancreas's decreased secretion of insulin. Insulin, of course, is a hormone that breaks down sugar. What causes diabetes? It is not caused by a single factor, but by multiple factors that add up to eventually lead to the development of type 2 diabetes. These factors include obesity, insulin resistance, the wrong diet, lack of exercise, older age, belonging to certain ethnic groups, and, as in your case, a family history of type 2 diabetes. Statistics. The incidence of diabetes mellitus. As obesity rates spiral out of control, type 2 diabetes is also increasing dramatically. The International Diabetes Federation estimates that 8.3% of the world's population, that is 387 million people, have diabetes. Of these, 46.3% do not know that they have diabetes. By 2035, another 205 million people will also have diabetes. There are two major types of complications when you have diabetes. They are microvascular, that affects the small blood vessels, and macrovascular, that affects the large blood vessels. Today we will focus on macrovascular complications. Macrovascular complications include damage to the blood vessels of the brain, leading to stroke, the heart, leading to heart attacks and chest pain known as angina, and the legs, leading to foot ulcers and amputations. The central underlying problem is atherosclerosis, which leads to the narrowing of the walls of the arteries. Another problem in diabetes is the fact that your platelets become stickier, causing blood to clot more easily. Cardiovascular disease include unstable angina, which is chest pain at rest, myocardial infarction, which is a heart attack, and heart failure. A huge landmark trial, which is a trial that changes the way we understand and treat an illness, the Framingham Heart Study, showed us that the risk of having a heart attack when you have diabetes is the same as a person without diabetes who already had a heart attack. This is equivalent to a 2 to 3 times higher risk. Cerebrovascular disease refers to strokes. Patients with diabetes have an increased risk for stroke of between 150 and 400%. The risk of developing dementia is also higher. A huge landmark trial, the United Kingdom Prospective Diabetes Study, has shown that by controlling blood pressure, the risk of having a stroke decreases by 44%. Peripheral vascular disease results from impaired blood flow, which is called ischemia, which, when coupled with impaired sensation, which is called neuropathy, lead to foot ulcers, which become infected and ultimately end in amputation. Patients with diabetes often have far less symptoms of ischemia than patients without diabetes. Is there light at the end of the tunnel? What you really want to know is, can complications be avoided? Although good blood sugar control goes a long way in delaying and in some instances stopping the development of these complications, it is unfortunately not always enough. Two huge trials try to prove that excellent blood sugar control alone prevents large blood vessel complications, like heart attacks and strokes, but they failed. They were the Accord and Advance trials. Preventative measures. As diabetes is such a complex illness, you will need to control your blood pressure, blood fats, weight, diet, exercise, and smoking in order to improve your chances of not getting complications. One of these big trials, the Steno-2 trial, clearly showed that. Glycemic targets. A lot of studies have been done to determine to what extent good blood sugar control influences the development of complications. A number of organizations have guidelines for blood sugar targets. The one used most is the one from the American Diabetes Association. Individual glycemic targets. Treatment targets are individualized and depend on your health, your age, other illnesses you have, and the risk of extremely low blood sugars, called hypoglycemia. Your healthcare team will discuss your targets with you. Compliance. Having diabetes is like sitting on a three-legged stool. The three legs are diet, exercise, and blood glucose control, which includes your blood pressure and your blood fats. If you lose one of your stool's legs, you are going to fall. Similarly, if you eat healthy and exercise, but do not take your medicine, or vice versa, you are going to fall. Diet. Consume a diet with a total fat content of less than 30% of total energy intake. Saturated fats less than 7% of your total energy intake. Dietary cholesterol of less than 300 milligrams a day. Replace your saturated fats by mono and polyunsaturated fats. Eat whole grain carbohydrates instead of refined carbohydrates. Eat at least 5 portions of fruit and vegetables per day, and eat at least 2 portions of fish per week, one of which should be oily. And then eat at least 4 to 5 portions of unsalted nuts, legumes, and seeds per week. Weight. Intensive lifestyle programs with frequent follow-up are required to achieve significant reductions in excess body weight. Reducing energy intake while maintaining a healthy eating pattern is recommended to promote weight loss. Patients who are overweight or obese should strive to reach and maintain a healthy body weight. Failing that, weight loss of between 2 and 8 kilograms may provide clinical benefits in those with type 2 diabetes, especially early in the disease process. Limit or avoid intake of sugar-sweetened beverages to reduce your risk of weight gain. Smoking. You have to stop smoking. Consult a specialist service to assist with quitting. If you cannot go for the specialist service, different medications are available to assist you. We can discuss this later. Alcohol. Men should not consume more than 3 to 4 drinks a day on a regular basis. Women should not consume more than 2 to 3 drinks a day on a regular basis. And avoid binge drinking over weekends. Exercise. 150 minutes per week of moderate intensity aerobic exercise per week, or 75 minutes per week of vigorous intensity aerobic exercise. Muscle strength exercises that exercise all muscle groups twice a week. And if you cannot attain these goals, then exercise at maximum safe capacity. Diabetes is a progressive illness, and therefore your medication will have to be adjusted from time to time. There are a number of pills available, as well as injectable forms, on which you will be placed in a stepwise manner. Eventually, most people with diabetes will require insulin. Bariatric surgery is also an option. Annual review. In order to reach your individual targets, optimize health, and delay or prevent complications, it is of paramount importance that you consult with your diabetes team on a regular basis. Let's look at all the different team members and how often you need to see them. The doctor. That's me. You need to see me at least twice a year for a thorough clinical examination. Your eyes, heart, chest, stomach, and feet will be examined. Depending on your clinical exam and your special tests results, your medication will be reviewed, and any other concerns you have will be addressed. You also need to see an eye specialist at least once a year for a dilated eye exam as well as a retinal photo. The Diabetes Educator. Structured diabetes education will be offered to you when you are diagnosed and at least annually thereafter. The Diabetes Educator is your go-to person for everyday queries and problems. Injection techniques, dose adjustments, medicine side effects, sick day rules, and all other worries can be addressed by your educator. Your educator should be available at short notice to respond to your needs. The Dietitian. Medical nutrition therapy should be offered to all patients at the time of diagnosis. You will see your dietitian at least annually. An individualized eating plan will be a combined effort between you and the dietitian. Your individual dietary preferences, allergies, and budget will also be taken into consideration. For patients on multiple daily insulin injections, carbohydrate counting is an option, which will allow more freedom in terms of diet and is a handy skill to learn. The podiatrist is without doubt one of the most important members of your team. At the time of diagnosis and at least once a year thereafter, you should consult with your podiatrist. A thorough foot exam will be performed. Attention will be given to the blood supply, nerve function, foot deformities, corns, calluses, fungal infections, the condition of your nails, the presence of ulcers, and the need for specialized footwear. The biokineticist. Exercise is one of the 3 pillars of diabetes treatment. For a patient with complications like heart disease, visual impairment, nerve damage, and amputations, the help of a biokineticist will be required in order to determine exercise capacity and to plan for a safe exercise program according to the patient's ability. A biokineticist can also monitor your progress and give feedback to the team. The pathologist is responsible for your blood tests. The following tests will be done: a full blood count to check for anemia once a year, your HbA1c to determine your average blood glucose control over the past 3 months, at least twice a year, but preferably 4 times. Kidney functions, your creatinine and eGFR to check for impaired kidney function, at least once a year, a full fasting lipogram to determine the different levels of good, bad, and dietary cholesterol once a year, and your urine albumin creatinine ratio to screen for microscopic amounts of protein in your urine once a year. So, let's recap the 7 C's of living with type 2 diabetes. 1. Control your diabetes. 2. Control your blood pressure. 3. Check yearly for cholesterol, foot and eye complications. 4. Check your heart. 5. Change your lifestyle. 6. Comply with medications and regular follow-up. 7. Check yearly for diabetic kidney disease, and if you have kidney disease, protect your kidneys from failing. As you can see, diabetes health really is in your own hands. Thank you for listening, and I hope you learned something today. Goodbye.